Hi everyone. This story in the Telegraph caught my eye today, and it's an important one, and it's going to affect a lot of us. If this is true, it's going to affect everybody, not only in the UK, but anybody who gets drugs that are manufactured from within the US. If this sort of rhetoric is not challenged, Trump threatens to use US trade talks to force NHS to pay more for drugs. The article says Donald Trump is ready to use trade talks to force the National Health Service to pay more for its drugs as part of his scheme to put American patients first. Mr. Trump has claimed that the high costs faced by US patients are a direct result of other countries' health services freeloading at America's expense. It's got nothing to do with the fact that we have a single-payer national health service. Nothing to do with that. It's got nothing to do with the rest of the Western world having a single-payer system. And the fact that the US has got a free market system where the pharmaceutical companies can price gouge the crap out of you and the insurance companies can price gouge the crap out of you. It's got nothing to do with that at all. It's all to do with the fact that we're selling ours cheap because our country puts life ahead of things like profit. Well, for the most part it does, and the US doesn't. Mr. Trump, Alex Azar of the US Health and Human Service. Alex Azar, the US Health and Human Services Secretary, has said Washington will use its muscle to push up drug prices abroad to lower the cost paid by patients in the United States. Right, okay. I'll read a little bit more. On the foreign side, we need to, through our trade negotiations and agreements, pressure them, as I said on CNBC. And so we pay less, they pay more. It shouldn't be a one-way ratchet. We have all some skin in this game. He continued, the reason why they're getting better net prices than we get is their socialised system. Well, that bit is true. We've got a single-payer system. But making us pay more for the drugs is not going to bring down the prices in the US. It's just going to make the pharmaceutical companies in the US even more profit, and even more profit going to the top 1%. That's what's going to happen. This is pure bullshit. This is pure propaganda. In the UK, prices are dictated in part by National Institute for Health and Care Excellence, which has been successful in securing discounts for some of the costliest drugs. Single-payer government-run health services like the NHS are able to use their negotiating muscle to pay far lower prices than their fragmented, insurance-based private American counterparts, to the fury of the US. Exactly. That's what it comes down to. Can you imagine if the entire healthcare system in the US was a centralized system and it was bought by one single payer? Can you imagine the negotiating muscle they would have? Can you imagine it? Can you imagine how much lower the prices would be? Can you imagine how much less money the pharmaceutical companies would make in profits as a result? And that's what it comes down to. This is not about making things less expensive in America, healthcare-wise. It's all about making the drug companies in America even more money. The article continues, America will not be cheated any longer, and especially will not be cheated by foreign countries, Mr. Trump said. In some cases, medicine that costs a few dollars in a foreign country costs hundreds of dollars in America for the same pill, with the same ingredients, the same package, made in the same plant. That is unacceptable. Absolutely right. Totally agree with you, Mr. Trump. Totally agree with you. It's unfair, it's ridiculous, it's not going to happen any longer. It's time to end the global freeloading once and for all. Global freeloading. Global freeloading. This is pure propaganda what he's spewing here. In the UK, there was some debate over whether the US could impose higher drug prices in the UK. How much the UK spends on healthcare and on medicines is a matter for the UK government, and it's not clear to us how the US or any other government would influence this, said Richard Torbett of the Association of the British Pharmaceutical Industry. Well, it's 100% clear. The article has a headline that says it. Trump threatens to use US trade talks In other words, he's going to do his tried and trusted method of trying to bully people. He's going to be slapping tariffs on drugs, export and import tariffs to countries that won't increase the prices or won't pay more for them. That's what it comes down to. He's going to be using the trade agreements. And he knows that with Brexit happening and everything being up in the air, we need trade agreements. We need trade partners around the world. So he's using that. He's not using it for Americans to pay less for their drugs. He's using it for the drug companies to make even more profit. The way medicines are priced, prices are set in the UK is governed by a voluntary agreement called the Pharmaceutical Price Regulation Scheme, which is negotiated between the global industry and the UK government. Exactly. It's a negotiation because it's all done by a single player who has huge amounts of buying power. Nigel Edwards, chief executive of the Nuffield Trust, an independent health think tank, disputed that British patients were freeloading at the expense of their American counterparts. No shit, Sherlock. There is no reason to suppose that more expensive prices for drugs in Europe would translate into cheaper prices in the US. Of course not. It would just translate into more profits for the American drug companies. USA healthcare prices are generally higher than Europe, and the absence of the sort of large-scale negotiation by the US government does not help. Exactly. This is more likely to be the cause of the high drugs pricing rather than one side of the Atlantic subsidising the other. It's not more likely, Nigel Edwards, it's not more likely at all. It's absolutely cast iron certain. Now, so why does he want to make the pharmaceutical companies more money? Well, because they give his campaigns and the Republican senators money in donations, i.e. bribes. I'm going to give you a couple of examples here of the sort of price gouging that goes on in America and how what he's suggesting here is just absolute propaganda. This is from Forbes magazine. I think this was from 2016. It's happened again. Of course it's happened again. A drug company has bought a drug that has been available as a generic elsewhere in the world for decades at a shockingly inflated price. The drug in this case is a steroid called deflazacort, has been approved for treating kids with Duchenne muscular dystrophy. So this is a children's drug that's generically available that has been bought by a gigantic company. What do you think they did next? It has fewer side effects than existing steroids, so it helps the children. And many patients have been getting it from Europe or Canada at a price between $1,000 or $2,000 a year. Yet a pharmaceutical company called Deerfield, Illinois, has gotten approval from the US Food and Drug Administration to sell deflazacort. The company, Marathon Pharmaceuticals, is charging a list price of $89,000. A 6,000% price increase. They haven't developed this drug. They're not having to get back prices from research and development or advertising or anything like that. They've literally just bought a drug that costs $1,000 to $2,000 a year that helps children, has less side effects, children who have got muscular dystrophy, and they've slapped an $89,000 price tag on it. Do you really think that price is going to come down if a few kids in Britain have to pay a bit more, if the NHS in Britain has to pay a little bit more to treat a few children in Britain who have got this Duchenne muscular dystrophy? If you honestly believe that, I've got a bridge to sell you. It doesn't stop there, and here's an absolute cast iron proof that your politicians are bought, and that's the reason why they won't tackle this healthcare issue and the fact that America pays, I think, is it twice as much as the UK does for their healthcare system and gets a level of healthcare that isn't even in the top 10 in the world. This is the pill that cures hepatitis C. A 12-week regimen of Sovaldi is necessary to cure this disease. In India, the cost is $4 a pill. In America, it's $1,000 a pill. This is what happens when Big Pharma has bought all your politicians. Which big politician have they bought? It's not a Republican. Joe Kennedy, the great Democratic rising star. Profits from stock in expensive Hep C drug. US Representative Joseph P. Kennedy has earned stock value of up to $435,000 from investments in Gilead Sciences, the manufacturer of the controversially priced Hep C drug. He personally, that's apart from the donations he gets and other senators and representatives like him, that's his personal gain. Is it any wonder that Joe Kennedy is against the legalization of marijuana when he personally profits from drug companies giving him donations and his stock in these drug companies that would obviously lose money if marijuana was made legal with all the health benefits that marijuana has? Is it any wonder he's against the legalization of marijuana? And do you think this story in the Telegraph is going to make its way over to the United States? Do you think that CNN and MSNBC and Fox and the New York Times and the Washington Post are going to report on this the way I just did? Of course not. They're going to parrot what Trump has said and then not even give any pushback. They're not going to mention single payer. They're not going to mention the fact that, hey, if we move to single payer, you realise healthcare is going to get better for everybody. Everybody's going to get covered, and it's going to be cheaper for everybody as well, or cheaper for 95% of the entire country. The only people who would pay more are likely to be the top 5% who can bloody afford it, who've been making out like bandits for the last 30 years when the Democrats threw them overboard for neoliberalism. Do you think they will frame it like that, like I just did? Of course not. They're going to push it and they're going to propagandize the American public, and the American public are going to fall for it. I can't come down on the American public for believing this crap. Because if all they're doing is watching CNN, MSNBC, and reading the New York Times and Washington Post, they're not getting the facts. They're getting bullshit propaganda. And we have to fight back against it. And Donald Trump, I've got a word of warning for him. The UK is his strongest ally and has been for 100 years almost. If he carries on this shit with his bully tactics, trying to hike up import and export tariffs like he has done with other countries, when the United States, if he does a misstep and something terrible happens, and if the Conservatives in this country, in the meantime, lose their majority or lose a vote of no confidence and Labour get in, he's going to turn around and ask the UK for help. And he's not going to get it. Because if that's how you treat your friends, shit. Who needs enemies? If you enjoyed this video and you want to see more, please subscribe and please click the bell down there so you get a notification of when I drop further videos. Otherwise, YouTube will hide the video from you. Yes, they have admitted that they do that. Also, we're facing an absolute onslaught in independent media from the establishment at the moment, including YouTube. I don't make any money from YouTube whatsoever. I rely totally on the audience for me to continue doing this. So if you can afford to send me $2, $3, $5, whatever it is that you can afford through Patreon, again, the link is down there, I will be eternally grateful, and it'll allow me to keep giving you the truth and cut through the propaganda and the BS that we get from the corporate and establishment media. If you can't afford to do it, please share the video as wide as you can. Talk to your friends and family about the issues that I and other channels on YouTube who are independent raise. Thanks very much for your support. We have to fight back against this. Till next time, peace and take care.